on, is that not? Oh, our mic's on. Is your mic on?
Speed it up.
Yeah. Okay, do you want to take a picture that looks like I'm online? It's good, isn't it? That's a proper studio.
Nice.
Come and have a seat with me. Right, you're gonna add topic. So you're going to press record. Do you want to turn that down a bit? So welcome to. Are we going to go live on? We'll go live on. Whatchamacallit when we finish the podcast, don't we? But we might as well be live on YouTube. Alright. Right, you ready? Are you okay with that? So that's where we are. Right, 3, 2, 1, go. Welcome, listeners, to another episode of 65 Medical Health Innovations, the podcast where we delve into advancements in healthcare and wellness. We're discussing today Pshot and Oshot. Joining me is Sam, a regenerative medicine expert, and she's going to talk about Dr. Abus's work.
Yeah, thank you, Paul. It's great to be here sharing insights of fascinating treatments and expertise of Dr. Abbas.
Before we dive in, can you give our listeners a brief overview of what we'll be covering in today's episode?
Sure, absolutely. So we're going to explore what Pshot and Oshot are, their benefits and how the procedures are performed. Highlights and unique experiences and the expertise of Dr. Abbas brings to the London clinic.
Superb. Let's start with Pshot, Sam. What exactly is Pshot and how does it work?
So the Pshot, or the prior-plus shots as it's known, is a non-surgical procedure aimed at enhancing male sexual health. It uses platelet-rich plasma, PRP, which is quite well known now, derived from the patient's own blood to stimulate tissue growth and improve blood flow.
Wow, that sounds intriguing. I mean, we know all about PRP in our clinic. What are the benefits that someone should expect from Pshot?
Many men report improvements in erectile function, increased sensitivity and enhanced sexual performance. It's also known for its potential in treating erectile dysfunction. Yes, certainly.
So Dr. Abbas isn't here today, but you're going to talk to us about his approach.
Yeah, we went and saw him last week. So Dr. Abbas is known for his meticulous approach. The process involves drawing a small amount of blood, processing it to concentrate the platelets, and then injecting the PRP into specific areas of the penis. His expertise and the procedure is quick, typically taking only a few minutes and little recovery time.
Wow, and safety, are there risks involved?
The procedure is very safe since it's using the patient's own blood. Risks are minimal, though there can be minor swelling or bruising as with any injection.
Okay, now let's shift our focus to the O-shot, what is the O-shot, Sam?
So the O-shot, or it's known as the orgasm shot, so it's a treatment aimed to improve female sexual health. So similar to the P-shot, it also uses PRP to rejuvenate the vaginal tissue and enhance sexual function.
And the benefits that women typically experience?
So women often report increased arousal, stronger orgasms and improved lubrication. There's also evidence to suggest the benefits of urinary incontinence.
What role does Dr. Abbas play in administering the O-shot?
So Dr. Abbas brings his extensive knowledge and care to the procedure. Though he's not here today, his approach involves drawing the blood, concentrating the PRP and injecting into specific areas of the vagina. The procedure is efficient, taking about 20 to 30 minutes and requires little or no downtime.
And what are the side effects? Are the side effects rare?
Yeah, they are rare. Some women might experience temporary swelling or sensitivity. Most women can resume normal activities immediately though.
Wow. This might sound like a stupid question, but how do people decide between the Pshot and the Oshot?
So it's all about individual needs and goals. So the Pshot is ideal for men looking to enhance sexual performance or address erectile dysfunction. The Oshot is more suited for women seeking improvement in sexual satisfaction or treat urinary incontinence.
Who makes the ideal candidate for these treatments then?
Generally healthy individuals who are looking for non-invasive options to enhance their sexual health are good candidates. A consultation always helps to determine the suitability.
Okay, so let's now talk about London clinics. Where are these treatments offered and what makes the clinic stand out?
Sure, so our clinic is renowned for its experienced team and commitment to patient care, with Dr. Abbas leading the way on these innovative treatments. Even though he is not with us today, his influence is evident throughout the clinic.
Yeah, I think I agree with that. Can you elaborate on what patients can expect during their visit?
Yeah, sure. So certainly patients can expect a personalised experience because everyone's different with their consultations and what their needs are. From consultation to follow up with assurance of being under the care of a highly qualified team, obviously led by Dr. Abbas.
Okay, so we're live on YouTube. We're going to be going live on TikTok very soon. So as we wrap up, let's recap on the key points. The Pshot and Oshot offer promising benefits for sexual health with minimised risk and downtime.
Yeah, exactly. So choosing the right treatment depends on personal goals and health needs. A consultation with an expert like Dr. Abbas is crucial.
We've received some questions because we did a pre-airing questions and answers. Can you shed some light on this? The biggest question is costs.
Yeah, sure. So costs can vary based on individual cases. Pricing information would be provided during the initial consultation.
But it's around the sort of £4,000 to £6,000 mark, isn't it?
Yeah, so I think Dr. Abbas does offer an ultrasound within that, which is an additional cost, but it heightens the Pshot.
Excellent. Okay, perfect. So that's the podcast done. So if you're listening on Spotify, we're now going to go live on TikTok where we're going to answer any questions that come about. If you're on YouTube with us, welcome. I know you heard the start of the podcast, but now we're going to go live on TikTok. If there are any questions on YouTube, then please let us know. So what we're talking about today is this Pshot and Oshot.
Yes.
Now, both you and I visited the clinic last week, and it very much looks like an operating theatre, doesn't it? It's very sterile and stuff like that. He was also talking to us, which we didn't cover in today's podcast, about when people have sexual health issues after having a baby with the
G-spot.
The G-spot being too high or something.
That interested me actually because so after having a baby, a lot of women it's known that the G-spot lifts.
Yeah.
So when you do have sexual intercourse, the penis might not literally hit the G-spot.
Right.
Which means your sexual experience is going to be pretty low. So what Dr. Abbas does is he makes the plasma, the PRP plasma from your blood into a filler, and he injects it above the G-spot, so then it pushes the G-spot down so that you're able to hit that area, and then again you can have a decent orgasm.
Wow. And I mean, I think for us what's amazing is obviously we are around PRP all the time, aren't we? So, you know, we're using PRP for fillers, we're using it for skin treatments and everything else, but to think that it can be used like this is pretty incredible.
Yeah. Hi, Sammy. Yes.
So if you've just joined us on TikTok, we're talking about how PRP can be used in sexual health. So if you've got any questions about that, then please let us know. We're recording a podcast, so on a Monday, Sam and I at this sort of time record this podcast. So while we're waiting for some questions, talk me through Pshot then. So when the man's got erectile dysfunction from maybe cancer or enlarged prostates, then that's the ideal candidate for him, isn't it?
Yes, once they're cancer free. Oh, Joe Pearson's online. Here I am. Hi Joe, we're seeing Joe later, guys.
Yes, Joe's coming in at 11:30, so that'll be
so
exciting.
he said about the ideal candidate being that type of person because they can't get a full erection. So then if the male can't get a full erection, the female's not going to feel as good of a sexual orgasm, and neither's the male really.
Yeah.
So he said that if you can't get a full erection, then that's what the aim is to get a harder erection, so then they can actually get a better quality sexual life with their partner.
Excellent. And I think one of the messages that I want to get across, obviously I know we're talking about this for sexual health, but it's more the sheer volume of treatments that PRP can do.
Yeah, I was shocked when it was PRP, that it was done by PRP. I
So was
thought, oh
I.
my goodness.
So was I.
I didn't know Pshot was done by PRP.
So like, if you think about it, in our clinic, we're doing hair, we're doing face, we do knees, and we do joints with arthritis and stuff like that. And then Dr. Abbas is doing the sexual health. We know the NHS are doing things like skin grafting. They're using it instead of amputation in some instances.
Yeah, diabetes.
For diabetes. I mean, where do you think it's going to end? I mean, do you think that some of the pharmaceutical companies have blocked this? Because obviously it's not new, is it?
No, I don't know if they've blocked it. I just don't think it's still mainstream. I think it's still on the way to being mainstream. But I wouldn't be surprised if it goes into organs eventually, because your liver naturally regenerates. Some of it does. And I'm just waiting to find a doctor who's cracked it and says, do you know what, we can inject your kidney and make it work better.
So Sammy's just on TikTok has said amazing stuff. We get it from our own bodies, and I think that's really
key.
what I want to talk about. I know that this podcast is about sexual health and PRP, but I just want to open it up a bit more and say
Hi, cooking.
that to think that we are mending or healing issues with our own blood, like you say, where will it end?
Yeah.
I mean, we haven't explored it yet, but I can't see why, if someone's got a major tear in their muscle, why we can't inject PRP into the muscle.
No, I don't either. At least it will speed it up without having as much scar tissue there, which when there's scar tissue in a muscle, you don't have the elasticity of a normal tissue, so you don't get full range. So if there is a process which you can inject PRP, the muscle should regenerate with normal healthy tissue, and you will still have the same flexibility in it. I don't see why not.
No, nor do I. I mean, we haven't done it yet.
As I say, I won't be the one to try it.
Well, I'll try it.
You'll have a go.
Yeah. I mean, you know, you think about today, for example. Let's look at what we're doing today. So, our first client today, we're doing arthritis for the knee. Okay, it's now a normal procedure for you and I to see this. We've done arthritis in the hands. We're talking about Dr. Abbas, who is now doing it in the penis and the vagina. We are seeing another patient this afternoon about hair. I mean, where's it going to stop? I mean, and when I think about the history of PRP, you know, we've got to remember that it started with the girls doing facials.
Yeah.
Vampire facials. Vampire facials.
Cooking, how to book an appointment? You need one.
So
you
in
can go onto
our
bio.
Yeah, in our bio is a link tree, and in there you can see where how to book an appointment. So if you go into our bio, there's a link tree.
Or Emma might be online soon, and she'll catch up with you as well.
So someone on YouTube is saying that they're blind with one eye retina displacement. Well, lens now. So I can see PRP making its way towards blindness as well. Why not? Why not? It's just that they've just got to understand, I suppose, where to put it and how to put it, I guess. If there's any questions on TikTok, so we're now bang live in TikTok. Any questions about sexual health with PRP, then obviously put them down.
Hey Surinder, we're not brother and sister, we just wear the same uniform.
I know that. Unfortunately, this is our uniform. We wear it on the train coming in, and that's about it.
Hi guys on YouTube.
Morning, Karen. So what we're discussing today, just before we close this podcast off, let's just go over it one more time. So Dr. Abbas is a colleague of ours. He works in London, in our London clinic, and he is administering the Pshot and Oshot. In this podcast, we've discussed the benefits. I think it might be worth just going over it just one more time. So Pshot is for the man.
P-shots are for the man, for erectile dysfunction, and generally for men who have had prostate issues or prostate cancer, who are now healthy from prostate cancer because they find that they have either erectile dysfunction or they can't get a full erection, which then affects their sexual life with their partner. And then the O-shot is for women. It will either be once you've had given birth and your G-spot lifts, it brings the G-spot back down, or it can increase your sexual experience, and also it can also help urinary incontinence after having childbirth. So it really will enhance couples' sexual experiences and their life, and just their relationship in general.
Absolutely. Hi Jennifer. So we'll close the podcast now, and then we can open up general questions for other things to do with PRP and other treatments. So if you are listening on Spotify, this week's over. Next week, I think we're discussing what we're discussing next week. We're doing back to the blood type diet and osteopath work. So so tune in. If you haven't on TikTok come across us on Spotify, then please do so. It's a great place to catch up some stuff. Hi Sammy. So we're now live just on TikTok and YouTube. Sammy says it's amazing. There are so many conversations being had about alternative options, and I think you're right, Sammy. And good morning, Jennifer. For me, being bang in the middle of it, there's not a day that doesn't go by that I hear about something else. But there's some odd ones, like chiropody, like with fungal toes. I spoke to a chiropodist last week, and there's nothing. Like, I don't understand why we can't inject, I know it hurt, but why we can't inject PRP under the nail.
Oh, I'd want some lidocaine. I know it dampens it down, but I'd want a lot of lidocaine.
I want lidocaine for absolutely everything. I need lidocaine just to go on the Elizabeth line these days, I tell you. So if you've got any questions for us, this is a general questions and answers now about any treatments, whether you're on YouTube or Spotify, then let us know. Of course, today is the big one. So today, Jo is on her way down. On YouTube, you will know nothing about Jo, but on TikTok you will, because she's certainly TikTok famous, this girl.
Yeah, she's this morning already, so here I am.
And this is before we've done anything.
Yeah.
Imagine what she's going to be like when we've finished her treatment.
What's she having?
She's having everything done. I mean, literally everything. I'm telling you, she's having her knees done. So that comes at what time?
Was it 10?
11:30. 11:30. Hi Bella. We are owned and we have practicing doctors in the company. We're not, but we have also nurses. Sunny? Who's Sunny?
I don't know.
Sam is an osteopath, so she looks after your...
musculoskeletal.
That's the word I was looking for. Or is it Halloween? I like your style.
If we cover ourselves in a load of blood, it might look
what do we think about Botox and Scrotox? Ooh, I don't think I've come across that, Sammy. Let's have a look, shall we? So.
Yeah, I don't know. I've never heard of that.
I don't think I've ever heard of that, Sam. Which doesn't mean that it's not right, because we haven't heard from it, but we're not going to make it up.
It's not been on our grapevine yet.
Let's have a look.
Interesting. Botox and Scrotox.
If you're winding me up, Sammy, and I end up getting some sort of, and I get some sort of issue, then I'm telling you.
What practitioner are you, Sammy? Love talking to our practitioners.
Yeah, we love it. We love it.
What would you prefer, a double chin, lemon bottle, or pine bottle?
What would you do for a double chin? Pine bottle all day long, pop. We
Oh, she's aesthetics advanced.
oh, lovely. So
Lovely.
you watch us quite a lot, Sammy, don't you? I'm glad you should come on one day and we'll talk about it.
Oh,
Oh, okay.
anti-wrinkle injections. I don't think you'll get Liv Jolanda doing that. She won't have that.
Well,
Oh, let's wind her up later and say we do them.
yeah, Sammy. Okay, that makes sense. What do I think about it? Well, I suppose it's logical, because if you're worried about that though, but I'm not sure I'm worried about lines on my testicles.
Well, it might be for adult models or something.
Yeah, I guess so. But don't they airbrush them?
No.
I'd like to know, Sammy, are you doing it?
Yeah, are you doing them?
If you're doing it, perhaps you can come on live and talk to us.
Yeah.
Oh, I'm just about to answer you, Pop. Sorry, we were just answering the question before you. Right, so let's better ask Poppy before she comes as a heart attack. So, Poppy, we did. Oh, sorry, she's now changed the rules. No, I don't think it would do that. When I've just Googled it, it talks about the appearance. I'm not sure if Botox would affect the flow. I think it would reject it, unless of course you inject
That's where
it.
you inject it.
Yeah, honestly, I don't know, Sammy. It's not an area that we get involved in. We can speak to Dr. Abbas about
He
it.
might know, yeah.
We'll ask him. So
Yeah, we've got a question
our
for
colleague Dr. Abbas, we'll ask him because
Let me
that's.
write that down.
So Pop Diana has said in a very, very, very strong way. Can we answer a question? So I think, should we answer a question now?
Yes, I'd like to.
Right,
answer
so me and Bina, I don't know if Bina's on. If she is, we'll add her to this conversation. We did a test on lemon bottle and pine bottle, and without a shadow of a doubt, pine bottle won. The reason being is that pine bottle has two extra ingredients in it. It has what does it have? It has glutathione, which we know helps with the cell productions, and it also has peptides that we see in Ozempic and Manjaro. Now, what we did, we took a pork belly, so we took the fat of a pig in the stomach, because it represents very much like our mid area, and within 10 or 15 minutes we saw the fat come away. Within 24 hours it had fallen away, yeah, so we love pine bottle. What we do here in London, we have fat freezing, so we use what's it called, cryo freezing. Cryo freezing. I don't get involved in that, but we have that. In fact, that will be live at some stage this afternoon, I think. So yes, I would go pine bottle. Bella, does lip filler fade away completely over years? Well, that's a really interesting question. So we've had a complete change of direction on what happens to filler. Now, what we believed was that over a period of time, filler would dissolve. The problem is with that theory is we're starting to find filler 10, 12, 15 years in the future. So I'm not convinced that lips will totally go away. It will certainly start to migrate if the border is pierced, because we see a lot of migration here. We see lots of migration here and around here. So I'm not sure it will totally disappear.
I had a friend who she was getting her lips done, but one side was metabolising quicker than the other.
Yeah, it's really common. We have a number of patients like that.
But it wouldn't go completely. Is that what you're saying?
Well, in theory it should.
Yeah.
But where we found this, I mean, I don't, it's really scary. Oh, someone's shouting at us. Hang on a second. Sammy's made a good point. I'll come away. So, Sammy, it's really good that you do watch. And we really, just on that subject, we want more and more practitioners to follow us when we do our lives and when we do these chats, because for two reasons. One, because we want to find some decent partners to work with, because we have people all over the UK asking us for treatments. And although we pay travel expenses if you're 100 miles away or more, Sometimes they want to go local, so that's one reason.
And also, it's just good to have someone else's opinion.
Yeah, and that's really important, Sam. And yeah, we want you to at some stage become more vocal and give us an opinion. Yeah. So, well, I Botox and Botox. Who'd have thought that?
Yeah.
What's the
I'll
best?
put it down to ask Dr. Abbas about
So
that.
we will come back to you on that, Sammy, and we'll let you know. What's the best way to do severe dark circles? Excellent question.
Redhead K.
Redhead K. Do you reckon the name's K? Or head?
I'd go for K.
Go for K. K, yeah, absolutely. If you'd have asked me that maybe 6 to 8 months ago, I would have gone down the road of maybe Lumi Eyes Pro or polynucleotide, maybe. Where we are now is PRP. I mean, without a shadow of a doubt, PRP, you might need a few sessions. I'd also go with glutathione and thoric acid and vitamin C in a drip. So it's called the Beyonce drip. Can you pass me a book down there? I've also written a book about it, so you can get this book on Amazon. I think it's free at the moment. So if you either search my name on Amazon, Paul Lomas, I've got 3 or 4 books out. This one is on glutathione, and what it talks about on this page is that when you mix glutathione, thoric acid and vitamin C, it will brighten the skin, the whole skin. So I would use that for sure. Is it common to migrate in other parts of the face? Yes, Bella, that's what I was talking about. So I've felt filler down here before that's migrated from lips. There's a doctor in Australia, I can't remember his name, and he's found it behind the orbital. So yeah, it can migrate. I mean, it's really good practice. See, Sam's now bored, scentless, because yeah, look at her, she's done it.
No, I find it fascinating.
Yeah.
Oh,
Oh, hello.
Hello. You see how-
Hold tight, hold tight. There's a doctor in Australia that has discovered that it's gone behind the orbital and ate away at the optic nerves. I mean, it is good practice to dissolve, and we try and get our patients to dissolve their filler as much as we can. Get into that picture there. Right, who's shouting at us?
Lynn.
All right, Lynn.
Hello, Lynn.
Filler migrates, especially when a cannula is used, as it makes wee pocket.
Wee pocket.
Are you from
Are
Scotland?
you Scottish?
I love that.
Wee pockets.
Scans have shown that filler is still present. Sorry, Sammy said. Where's she gone?
Lynn, are you a practitioner yourself, or is that coming from experience?
Scans have yeah, that's a good question. Showed that filler is still present years up there. That's right, Sammy. That's what we were talking about. That we've seen filler 10, 12 years plus, which is really scary. Joe's on the train. Look forward to seeing you. Makes me wonder if it's the older fillers. Maybe. That's a really good point. Lynn, polynucleotide lemon bottle is amazing, absolutely, but it's not as good as pine bottle for sure, and we've proved that. Kaylee, hi Kay, how can we get hold of pine bottle? We can sell it to you. We bring it in from South Korea. It's a South Korean product. Now, lemon bottle was the #1 product across South Asia. It now isn't. Pine bottle's taken over. So if you want some, we can get it for you. I'm studying, Bella says she's in the science field. I'm interested in plastic surgery. Fantastic, Bella. Such a great career. Lynn, PRP versus polynucleotide. There's no comparison. Polynucleotide wins every time. All my clients love it. Lynn, really good debate, and I'd like to have that with you. I think the only big difference between PRP and polynucleotide is that PRP is forever. So we've got to remember that PRP and PRF regenerates. So with a number of treatments, 2 or 3 PRP treatments, it's going to keep regenerating. And what we found is if we use PRF on top of the PRP, it creates like a matrix where the PRP sits below. I think there's horses for courses. what would I stick under my eyes? Probably PRP, because I don't want. I'm now at the stage with me where I choose my blood over any commercial product.
Yeah.
Oh, Bliss, hold tight.
Hold tight.
Good to see you, Bliss. How you doing? Are you going to be here, Bliss, for the 11:30? Just on that subject, 11:30 is the big one. Jo is on her way down. If you've been following the lives yesterday, then you are in for a treat today. So Jo's coming down and we're doing a full facelift. So that's going to include fillers, Botox, threads, surgical threads, the lot.
Wow.
I'm looking forward to
It's
it.
going to be a little pin cushion. Bless her.
Never had a client it didn't work on. Be careful where you go. Yeah, that's exactly right, Lynn.
Oh, you're Irish?
Is this the first time you found us on TikTok? Because
I feel like I've seen Lynn's name before.
that's what we practice. That's what it's all about. Making sure that people go to nurses or highly qualified assistant practitioners. Oh, thanks, Bella. Hi, North London girl. How are you?
Morning.
One day you should come on a Monday
She's still waiting for a steak from you.
and do our podcast. Alara, is it Alara Beauty
Alara
123? Yeah, just drop us a note. So come in and drop us a mail and we'll contact you. No problems at all. Only because Lynn goes on and talks about she's had no results with PRP yourself. Now that's a common thing, isn't it? Lynn, it might be down to how it's spun. It's even down to the vials you use. So if you use the wrong vials, it will degrade the PRP. If you look at my face, it's now full of PRP. So in my hair is PRP and PRF, and you'll see it's generated a whole bunch of hair. I use PRP across instead of Botox these days. I've got filler out of my blood in my jaw and my cheek and my jaw. I've got PRP filler here, so I'm really full of it actually.
Full of his own blood, it is.
Whereas before it was filler. Bliss, can PRP be injected into the lips in place of factory filler? That is such a good question, Bliss. So PRP can be injected in, and in fact I did it live about 6 months ago, where one of the nurses injected it into my lip. What you don't want to do is put PRP or biofiller. So what you don't want to do is have it when it's cooked. So do you remember there's the two sorts? I think I might have some here. Hang on. Let me have a look in the fridge.
He's in the fridge, guys.
Oh no, all I've got is a lollipop.
Won't do.
When you see me live tomorrow, Bliss, from Brentwood, then remind me. But basically, when we cook it, we make it thicker, don't we? And you don't want that put in your lips because it's forever. You can't get rid of it.
Ooh.
Whereas PRP as a fluid is fantastic. I know, Bliss. I'm really excited as well. PRP may be in the right hands works. Yeah, I agree. Oh, thanks, Lynn. We love you too. North London's laughing. Will it still migrate if you had filler once? Filler can migrate regardless of how many times you have it. It's all about the technique. And yeah, so I don't think it really matters about overall. I mean, if someone hits the border, for example, it's going to migrate. So no, it's not about the volume of filler, it's how it's done.
Selena, I'm full of fillers. You own it, girl. So what?
Are you full of fillers or am I full of fillers, Selena? Because if it's you and me, then that's what we have in common. Oh, Bella, are you going through a book of questions to ask an aesthetics person? I like it. We love salmon DNA. So salmon DNA appears in nuclear film, and it appears in I think it's Lumi Eyes Pro. We also have salmon DNA in its own little bottle from South Korea. I think the problem with all these things, we think they're brand new and we talk about them as if they're brand new. When I meet my South Korean fellow doctors and distributors and stuff like that, they laugh at us because I'll go, oh, what about salmon DNA when I first spoke about it? And they've been doing it for 25 years.
Yeah.
So we are so far behind. And in fact, one of the things that I talk about on some of the lives is that if you've ever got a spare afternoon and you live in London, then Google South Korean pharmacists, because actually going to those chemists is a whole lot of fun.
Is it? What, in London?
In London, yeah, there's about 60 of them. And make sure it's a pharmacist, and they'll spend all day with you talking about their creams and potions. But they are just so far ahead. Only a black eye. Exactly, it's all about administration. That's right. Thanks, Lynn. Oh my God, there's a load of questions
Lots
here.
of questions. Oh, that's nice.
I recently had threads. They still look quite prominent. Any suggestions? Yes, Tina, I'd like to have a look at that. So if you want to send me some questions, send me some photographs, I would like to have a look at that if you don't mind. Joe, yes, you do pay for your taxi and I'll give it you back. I'm not going to run out of clinic for you. God, what else does that woman want?
I'll give you money back when you get in.
Yeah, we'll take it off your price of your treatment, Lynn. Joe, I suppose you didn't get me to pick you up.
Get on one of those little tuk-tuk bikes.
You're the most informative live I've come across. Might need to follow you. Bella, honestly, it's not just what we talk about here. So our format is very similar every week, isn't it?
Yes.
So me and Sam, we do a live podcast on a Monday about 8:30, which we then turn into a questions and answer session on TikTok. And then through the week, we have nothing but live treatment. So today we're going to be seeing Joe have a full facelift. And what else will they see today? They're going to see hair being used, PRP. I think there's a whole bunch of things happening today. So definitely follow us if you're into that sort of thing. Zodiac, how can I treat upper lip lines from the nose to the mouth? So do you mean here, across here? So traditionally, what we would always suggest is Botox there. But now with things like polynucleotides that Lynn and I have been talking about, or PRP, I would use there now, to be honest. So you've got lots of options. I even on a client who was really old, we used
They're not straight.
Botox. What's not
Rose is
straight?
telling me my badge is not straight.
Oh, and it's either that or you're wonky.
I'm probably a bit of both.
You're probably a bit of both. Hold tight.
How tight?
Oh, well, I'm not going any lower. There you go.
Thank you. It still looks well.
Do you do fat result? Yes, we do. Pretty little sense. Oh, I think I've seen you before, Gemma. Hi, yes, we do. Of course, we do. Just little giggle. Can the lady put her badge straight? OCD.
There is. It doesn't look straight on there.
There you go.
That's better.
Rosie,
I won't move.
hold tight.
There we go.
Sammy, in Australia, Ozempic has also been used to treat alcoholism. Yes, absolutely right. So, as you know, where's Sammy gone? As you know, Sam, I think you will know because you followed us for a little while. We're heavily into Ozempic and Manjaro. My book is just about to come out. It's still with the publishers, but I'm written a book about the benefits of Ozempic, and it's now been hailed as the landslide drug since statins. So yes, watch this space really.
Just message good. We'll pick that up in due course.
Tina, they would dissolve but wouldn't recommend threads. Okay.
Have you had it?
Oh, thanks, Original London. We love you. Where are we? Pick you up, yeah, in your dreams. So, Gemma's on Manjaro at the moment, and you love it. Yeah, I mean, I've got some patients on Manjaro, and they are having such a bad time, like really bad time.
Hello.
Yeah, blood pressure dropping really low, and stuff like that. But then saying that, I've got a ton of patients on Ozempic with bad side effects. I think as long as they're managed, that's what it's all about. Zodiac. So, do you suggest PRP? And is that something you offer?
Fast.
So, Zodiac, yes, we do recommend PRP, and yes, of course, we do it. If you're more than 100 miles away from clinic, we pay for your travel for treatments that are over £500. So, depending where you are, we're super placed. We're in West London. Yes, I'm going to send you a copy, Sammy. I think I promised you that before. So you'll get a copy, no doubt.
There we go. Oh, I have to get limbo.
Yes, we do Manjaro. So what we do with our weight loss stuff is we're slightly different to other people. So when we work with you, we'll do a consultation either face-to-face or we will do it over FaceTime. And then from there, what we do is we prescribe you Manjaro or Ozempic. But then after that, you get to work with a nutritionist. So you get to speak about your food, because what we like to do is try and get you on the drug and off the drug as quick as possible. The same day, Tina. So literally, once you inject Manjaro or Ozempic, you literally won't be eating that afternoon.
No.
I love it. I love it. Do you know what? I love having, I shouldn't say this because it's prescription only medicine, but I do love it, having it before my holiday. And then when I'm lying around the pool and it's red hot and everyone's like, oh, need to eat. I'm like, nah. No, I'll stay here, thank you. Just bring me back an apple.
Yeah.
I love it. 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 If you're having, pretty Gemma, food noise. Glad you said it. Bina's here. So fans of Bina. Fucking hell, they've been after you for days. If you're having food noise, Gemma, then I would go for Ozempic. Ozempic now has been proven. Yes, we do, Bella.
I've never heard it being called that, food noise.
Food noise is a really important thing. So some patients have, especially with PCOS. So if you have PCOS, then food noise is a really important thing. And you are, with Ozempic, it switches it off instantly.
Can you prescribe Ozempic? Bella wants to know.
Oh, it's working with Manjaro as well. Well, that's really interesting because a lot of people don't say it does. So if that's it, constantly eating sugar. Ozempic is 100% guaranteed to stop food noise. It's good that you're finding Manjaro, although it's not common. So you're lucky, which is fantastic, Gemma. Oh, so are we, Lily. In fact, here is the lady of the moment. Come and have a sit here, Bina, and tell us all about what you're going to be doing today.
So we're going to be doing some threads today. Or we're just going to do like a whole rejuvenation of a client we have from TikTok. So it's going to be exciting.
She's on her way now.
Is she?
Yeah.
Nice.
Jo's been on here, so she's been letting us know that she's on her way now.
Yeah, so we're going to be doing threads, fillers, just anything to bring back that volume that she's... I'm fine, thank you.
Sure. Do you want nice tea?
No, I'm all right.
Keep talking then. Tell her what you're going to do.
Yeah, tell me about what it is exactly you're going to do.
So first we're going to obviously assess her phase, see what she's comfortable with doing. But we have an idea of what we would be doing, which is threads and some filler in areas that she's lost volume. So we just want to give her that 10 years younger look. And she's had threads. Jo has had threads before, but she said that it didn't do much. So just hopefully this time it's good.
Yeah, cool. Yeah, it'd be really interesting. Just going to come back to some of your questions. So on Manjaro, second week, injected into stretch mark, painful, red, sore and leaky. Have you ever had that?
No.
Anything?
No,
Would that be because the stretch mark is maybe scar tissue, so it might not be healing properly?
maybe try injecting a different area. I'd say try to avoid areas where it's a bit.
The skin's not
Yeah,
quite healthy. Yeah, no worries there. Pretty Little Sense. Do you recommend Manjaro or Ozempic? Is Wegovy Ozempic?
Yeah, Wegovy, it's got the same. What are they called? The same.
Components?
Yeah, the same components as Ozempic, but I think it depends on your weight, your journey, in terms of which one's best for you. So.
Try to tell you a bit more. Lynn meant to recommend Fred's, but would recommend PRP and polynucleotides. Oh, we've been having a whole about 4-way discussion, haven't we, Lynn, with some others on here. Steph, I've got a lot of health problems. Can I have the weight loss things? So if you want the weight loss jabs and stuff, you will need to do a consultation with one of our medically trained. We've got a pharmacy and a nurse that does all the weight loss consultations. So if you did want to arrange a consultation to see if you're able to do it, then we'll just, if you go to our bio link and pop a note, and we'll get someone to give you a call or arrange a little meeting. Sammy's saying hey to you. She's definitely said hey to us already today.
Oh, hello, Sammy.
Hello, where are we? So, sort of. There we are. Do you think you're feeling different yet? Oh, Lily's asking Zara a question. No worries. Would love to have you all on my emergency support UK page. Sammy, we would love to be on that. If you pop us a message as well on the bio, we can sort something out, maybe, possibly, and maybe put some links on for you as well, and just have that sort of like continuity referral sort of thing going on. Where are you based as well, Sammy? Are you local or are you cross country? Where are you? Love Freds. If you need a face, if your face gets, can't read now. If your face gets botched, what do you do in that case? Oh,
From the threads? Are you talking about botched from the threads or?
just in general. Yeah, let us know, Bella, what you mean by that. Pretty Little Sense, I get red rash after injecting using Savlon after injection. Oh, okay, so that's a good one for, can't remember who said about her stretch marks, but yeah, try that maybe. I love how everyone else gives answers now, it's brilliant. What is the price for Manjaro? Bina?
So it's $245 for the whole pen, or you can have weekly injections for £60.
There we are. No, I'm in North Lincolnshire, but I have practitioners on it from all over the UK. Oh, cool. That's yeah, not well. You are a little bit far, but that's good because we want people around the country anyway. So yeah, let's send us a message and we'll sort something out. Do you do threads in the face? How much?
Yeah, so
Your domain.
well, we had a discount at $800 for full face threads, and that's the PDO threads. But now we use a different brand called Relife, and they are threads that are only medically used, but they have the threads that the material is made out of is much stronger, and it is known to last a little bit longer. So them threads are about 2,500.
Cool. Bella, just with fillers because it's most likely to be migraine. Oh, how do you sort out botched face migraine with fillers then?
Well, we just dissolve them. So yeah.
Dissolve and start again.
Yeah.
If they want to start again, obviously.
Yeah.
How long do they last? Does it hurt?
So threads last about 2 years, but it depends on the person as well. So some people, their collagen wears off sooner than other people. And does it hurt? No, because we inject local anesthetic, so it's a very comfortable procedure. The only thing you can feel is pressure. So it's like when you're at the dentist, you can't feel the pain, but you can feel them playing around with your teeth. So it's a similar process.
Yeah, I've actually watched it quite a few times. Well, you've had it done, haven't you,
Yeah,
Freds?
yeah.
I've watched it and it looks so painful. And every time everyone's like, can't feel a thing, Cannot feel it. What would be the best treatments?
For jowls, probably threads.
There we are. 2,500. Are you joking? No.
If you can do a bit of research about the Relife threads, they are a very good quality thread. And they're expensive threads anyway. So
Yeah, I think some of the threads are like 800
Yeah.
just for one thread. So yeah.
and it's about the technique and the person that's doing it as well. So only medical
Insurances.
preferred.
Yeah, so unfortunately it has to be a little bit more pricey. Can you 100% dissolve everything? I don't know.
Not everything, just fillers.
There we are.
So,
Yeah, just fillers. At Jack Dav, you're paying for quality and medical qualifications.
Yeah,
Thank you,
exactly.
Lily. Yeah, definitely. It's too expensive. I know. She has her own clinic and does it for 200. She's very good. She's getting what thread she's getting. She might be getting
what materials them threads are
different
made
threads.
out of.
Yeah, so she might be just getting different ones. But yeah, if she's very good and it works, you know, that's what people want to use. That's fine. It's just we're obviously also in London. We have a lot of overheads we've got to pay as well, guys.
It's not just that, the threads. I mean, you can buy threads in Korea for £20.
Well, that's what she just said. She's got someone here who does it for 200, which
Well,
is fair enough, but
makes sense, yeah.
it's just where you want to go and who you want to use. Jack Dav, Christ, I can get a whole woman for that entire land. You probably bloody could. You probably get maybe an arm and a leg over here, but that's about it. Maybe book a flight then. Is it a woman? No, you sure? You never know.
Yeah, in Thailand as
They're
well.
very good looking in Thailand. You never know until it's too late. Oh, you might get 2 for 1. You never know. Right. This is Botox for 100 quid thing. This is like the Botox thing for 100 quid. What's that? I don't know.
Oh, she's talking about like the threads comparisons. Like there's some people that charge it for way less.
Oh
Botox.
yeah,
So,
yeah. It's like anything. Depends where you go. Depends on what you know.
What they're using products.
Yeah, and it's just what people want to pay really. Sometimes it isn't about the price, it's about getting the right treatment and it done properly. It just also depends who you trust as well, Missy. I know people that will start off very low to obviously build a client base, and then when they get more established and they get good references, you start putting your prices up. It's just life. Hi there. What's best for fine lines?
I would say because they're fine lines, probably filler or PRP. PRP is really good for fine lines. They just help rejuvenate the skin, help get rid of little lines. Great for the skin. It's like a skin booster. So. Smile lines.
Iraq is also very tricky.
What's she?
Iraq is also very tricky. You might not come back though, Bella. Oh God, you never know. Yeah, so yeah, just it all depends on what you want to pay, where you want to go. It's everyone's preference. It's just I hear some people's prices and I think, what? Have I got a red carpet and gold and grapes for to me? But yeah, it's what people afford and what people can't afford. What else do you do apart from threads for jowls? What would you recommend?
We could do filler as well. So sometimes we try to blend the jowls with the rest of the jewels, so we feel away from the jowls so that it kind of blends. But yeah, we can do filler. But I'd say threads is probably the best to lift it away.
You like threads, don't you?
Yeah, they're good.
Why not? Any other questions, guys? If not, we'll probably wrap it up now. We've got a few bits and pieces going on. We've got Fun Jolanda. We should do one called Where's Jolanda?
Yeah.
I might get her a Where's Wally hat. Love you, Jolanda, if you're on here. She'll fight me and go, oh yeah. Right, so what else is there? What time is Joe arriving? Joe, what time are you arriving?
I think she's on at 11. She gets here at 11.
11,
And then we're doing her treatment at 11:30.
Yes, we'll do a case history and everything. What was it? You mentioned the training courses.
Oh yeah, just about the nurse-led training courses.
So guys, we are starting a brand new academy here. We have got an academy here anyway, but we're doing on more. We're just launching new courses and new packages. It should be starting in December. If anyone is thinking of changing a career change, or they want to get into something a bit more self-employed, or work in this sort of industry, we will be looking at, we are going to be starting courses. We're going to have when's our website launching? 1st December?
No, it's in.
Oh, it's in. Our website is in. It's 65 Training Academy.
No, just training.co.uk.
Oh, 65training.co.uk is the website. There's lots of different packages on there. We're actually still adding packages as we go along. But it's sometimes a nice way to start your new year if you do want to change your career, change of what you're doing in life. So just to let you know, we're doing that as well. In Pakistan, they have street dentists now. No!
It wouldn't surprise me.
Wow! I want to go over there just to see.
Wouldn't surprise me in the slightest.
There's got to be one on TikTok to show us, you know, where they do the travel ones. You've got to have that. Doesn't surprise me though. Yeah, it is on TikTok. I'm going to have a look, Missy. I'll be on my TikTok later. Paul wondered what I'm doing. I'm not working because I'm sitting on TikTok looking at Pakistani dentists.
Let me wrap it up for you.
Right, Paul's coming back, guys. Do you want me to sit here?
Hold tight.
Hold
You
tight.
stay there, Bean.
I'm going to
Sit
jump
there.
over.
Give Ben your thing. Right, so I'm back. Apprenticeships? No, we don't. I mean, we've thought about it. The problem with apprenticeships is obviously just the money. Right, so what's Sal Sab said? 2 places. We don't really charge Botox like that. What we do is we charge £200 to do your Botox, and the girls will do it wherever's necessary. So, for example, if we feel like we need to lift your marionette lines up, they'll stick some there for you. So we don't really work like that, Sal. So just come along. It will cost you £200, and we'll put the Botox where you require. So I'm looking forward to today. So it's the first time I've had a chance to talk to you about it. So we've obviously looked at Joe's picture. I've looked at Joe's picture, and I'm quite excited about what you're going to do here. This is her main area that she's really concerned about. So I think if we can get some filler in there and then lift.
That's what I was thinking.
I've sort of spoken to Joe about the fanning technique.
Yeah, that's what I was thinking. So I was thinking starting with Fres to see how much it pulls, and then obviously there's still going to be them smile lines, so maybe to add filler and like fan it around, so it just kind of, and then maybe some filler to add volume.
Yeah,
just lift
and maybe even the cross threads across here to bring it all up. I mean, I think with Joe, so I'm looking away because I'm talking to, I think with Joe it's going to be so exciting because she's been so vocal.
Yeah.
So yeah, I've been looking forward to it all weekend.
I know. So I've been like figuring out what should I do. What should I do?
It's going to be a fantastic one. It really is. Hi Helen. Yeah, we do. So with Botox for us, and we're probably about to give our secrets away now, but what does it matter? My opinion of Botox is that it's a commodity that we have to help us get to know our patients, because they've got to come back every 12 weeks. And if we do give a lot more away than perhaps normal people do, predominantly because you just get to know your clients. Because I mean, how have you found that? Because you've obviously been here a little while now. Do you find that having people come back every 12 weeks for their Botox allows you to build a relationship up?
Yeah, definitely, and it's like it's help for them too, because they always have something else that is concerning them as well. So for them to know that you could place Botox in so many areas and it comes within that deal, it's so great for them. They love it.
And what does it really cost us? Not very much, really. I mean, you need about that much Botox to up a marionette line, but obviously for the patient it means a lot more, doesn't it? What clinic are you talking about, Sal? So if you're talking about London, on a Monday we have something called the Monday Club, which basically means people just come and go as they please. The rest of the time you're far better to get an appointment because it's really busy, or you might be waiting ages. But Monday in London is fine. You could pop down any time today. Alright, so if it's Monday, then yeah, pop down, but I would just do an appointment. It's dead easy to book. You just need to go into the link tree on our bio and then follow the prompts to book London, and then you can choose Bina, me or Jolanda or whoever you want to do your Botox. Who is she going to choose? If it begins with B, it's alright, I'm going to knock her out. Right, so talk about other things. What does a nurse that does Botox do on a weekend? What did you do?
That's my usual weekend.
With your sisters?
Yeah.
Oh, lovely.
Yeah, just
Did
take
you
my
go anywhere
sister
nice?
out. No, just the usual trampoline park.
Oh, she loves the trampoline, does she?
Yeah.
Little baby
Yeah.
sister. Well, my dog, oh, thank you, Celine. My dog was ill all weekend.
Oh,
So
God, yeah,
Lily,
sorry.
yeah, Lily had hysterectomy. I don't want to say the word spade because it sounds awful, doesn't it? It sounds like you've hit him with a spade. So she had a hysterectomy, and
How was she
she
now?
was really ill. Bless her little heart. She's all Saturday night. I was up with her. It's like having a child. I don't know if any of you've got a dog, but honestly, they're like kids. She all night she wouldn't sleep unless she slept here with her head on my shoulder, and she was just down there. So. I know, me too. Just another TikToker. We are so excited. I mean, we've this thing has been bigged up so much. Honestly, you'd honestly think it's one of our famous clients coming in. Obviously, being in London, we have a lot of famous clients, but who would have thought it? Yeah, we are so looking forward to it. It's going to be fantastic. I think for me, and I don't know if Jo's still on, but I hope she isn't. For me, the reason why I'm looking forward to it the most is because she's been stitched up.
Yeah.
So. In it for
That's what I
me,
said,
yeah, it's just, you know, she's a normal person. She works at a Premier Inn. She's, you know, minimum wage. She obviously saved up all her money to have her face done for her 60th, and somebody just took her money and didn't do anything. I think it's disgusting. So I'm really looking forward to helping her out. So don't forget to follow us at 11:30 today. That's the big one. We're also going to do some hair today because my hair needs doing. So we're going to do hair. We're also doing fat freezing.
Yeah.
I hear. So Bina's going to be doing some fat freezing. So if you're interested in what's it called, Cairo, where we freeze the fat. Now, what's interesting on that? We use lemon bottle as well. So lemon bottle it, then freeze it. It's like double blowing it up, isn't it, I suppose?
Breaking down the cells even more.
Breaking down the cells even more. So yeah, so that's what we're doing. I know, Bliss, it's going to be exciting. And then I think we'll hopefully dip into the academy as well today. Oh yeah, that's really good. That's a really good point, Bliss, and thank you for. Our followers the best. Yeah, don't forget to repost it when we do go live at 11:30 because although it's not the first time now, because last week it was the very first time people saw it live.
Really?
With the needle and thread that you did. Do you remember?
Really? They kept going on.
Yeah, so it's going to be really important to get this live out today at 11:30 and to see Jo's face. And what's going to be interesting is when Jo comes back onto these lives.
Yeah. Because it's going to take a couple of days for it to all
Yeah,
settle in.
and we'll start to see her. So the other thing that we're going to start doing from today as well, so to get your head around it, is we're going to start doing live consultations. So if you're brave enough and you want to come on live, then you can talk to a nurse about your issues in front of people. Now, the reason why I want to try and advocate this is because one of the things that this channel is all about is not just selling the treatments. That's not what we're here for. It's to help people who've got a fear of maybe coming to a clinic or have a fear of it. I mean, you see a lot of these patients, don't you, where they're really nervous. So we're trying to help with that. So if you are willing to do a live consultation, then just let us know when we're live. We can do it in any format. So regardless of what we're talking about, if at that point you think, yes, I wouldn't mind a nurse talking to me about my particular face, we'll bring you on live and we'll talk about it live. I mean, do you think that would help?
It would definitely help. And I feel like it's such a nice little community and everyone's so supportive, so I feel like it'll be really nice.
Yeah, and I think that's another good point.
Yeah.
In the early days when we first started this last year or the year before, we had loads of aggression and loads of bloody keyboard warriors, but we seem to have got rid of it. They've gone somewhere else now. I wonder who they're picking on now, do you think?
A
lot of people, probably.
Eh?
Probably a lot of bloody people.
But don't you find as well, I think the Monday morning crew are the best.
Yeah, they're not, the keyboard warriors aren't up and about yet.
No, they're still in bed.
It's after they've had a bad Monday, then they're like, right,
Right.
pick on.
And Emma's coming today.
Oh, is she?
Yeah. So for those who've never met Emma, we'll drag her on camera today. So Emma's the voice behind the customer services line. So the person you speak to. Oh, hello, Joe. You're still here. I'd like to do a live post-treatment to show the after results. Oh yeah, Joe. Don't worry about that. We'll be doing that. And Emma says she's on her way. So yeah, we're looking forward to seeing Emma here. Right, it is 10:10. We've got to get ready for clinic. Our first patient arrives in 5 minutes. Joe, get here for 11. So if you get here early, there's some beautiful restaurants and cafes opposite the clinic. So we're pretty full until 11. So we'll see you at 11. Everybody else will see you at 11:30 for the live. Me and Bina are going to sort out the clinic, ready to start. Sam, what are you doing?
Doing that bloody course.
Hold tight. Sam's doing a course. All right, we love you.
Bye.
Bye.
Bye, guys.
£2.1k.
Lovely.
That's good, isn't it?
How long was that one?
How long?
58 minutes.
58 minutes. Oh, that's perfect. Repost it. And we did something about Pshot as well, which was quite good. That podcast worked really well, didn't it? And I need to answer that question that lady's asking.
Oh, there's that Sammy wants us to go on her website or something.
You alright? Tell us about the course.
It's so simple.
Is it
that one?
No, this one is one I've been faffing with the weekend.
That one's so difficult. That one.
I've lost. I've been trying to do the
There's
second
so many
one,
sections.
second one, but I can't find a bit that I went through. So I'm going through it again.
Morning.
Um,
It's going to be a good day today. Did you speak to her about this 2 o'clock?
Yeah, she said they're gonna rebook.
Oh, right.
so you've done the £65 thingy one.
The fat freezing one, that one's easy. It's like they have like 10 questions and you just write like a paragraph for each one. This one, this teaching one is the hard one, yeah. Oh my god.
Yeah, so I was trying to get it up. I was trying to get this one done. I was going to have a look at the fat freeze, and he said you was going to.
Where's the,
I'll let you go and see what it's like before I got it because I'm not aesthetically trained or anything. But I didn't know if it was worth me.
Was it easy?
Yeah. Have you
It's
finished it?
easy, yeah. It's just it's got 10 questions. You just write a paragraph for each one. Then the practical exam is you have to take a picture of each part of that machine and then demonstrate on someone. That's it. And they give you a
It's
certificate.
good.
Yeah, that's nice.
So we do that. So should we do that?
Yeah.
Do you want to do that now?
No.
We got time.
You want me to do it on you?
I don't mind. Or we can do it on Sam.
Yeah, you will.
Yeah.
You don't have to do the whole treatment live, do you? Recorded?
Yeah, I
Just-
have to record it, like showing me doing it on someone so they know that I can use it.
Oh, well, we might as well go live and do it live then.
Okay.
Yeah, sorry. I thought you meant just...
Where is it? It's tree off.
turn YouTube off. Well, goodbye, YouTube.
Yeah, Jatinder's meant to be in now for his knee.
Yeah.